The waist-hip ratio is a better measure of your risk of metabolic health than your weight or your BMI. So it's so simple. You take a tape measure and a calculator. You can do it in your head, but you measure the smallest part of your waist. And if you don't have a small waist, if it goes out, then just use your belly button. Just use something you can measure again.
Are people sucking in or are they relaxed?
You should be relaxed.
Okay.
And I tell my patients, do it first thing in the morning when your bladder's empty and you're not bloated and, and then the widest part of your hips. It's not perfect, but it's better than your weight or your BMI.
So widest part of the hips with people with feet parallel,
just
standing
parallel,
together. We're trying to
standing
get
up
for people
straight.
because people are going to go try this, right?
And so I only know the data for women, so forgive me, but for a female, if it's less than 0.7, then your chance of having clinically significant aberrations in visceral fat are low. And then if it's greater than 1, you likely have higher levels of visceral fat. And so in clinic or when I was coaching online for Galveston Diet, we were using the waist-hip ratio as one of the measures for their success.
When measuring the waist, which point along the waist? Is it right at the navel? Is it?
It's just wherever you're smallest. So that's kind of different for different women. So I would just say, look in the mirror, wherever your hourglass goes in is where you want to kind of stick to. But if you don't have that kind of a waist and you have a wider waist, just pick the belly button because you always know you can go back to that level.